A hamstring injury is an injury to the muscles that cause the knee to flex. It's an injury to the muscles in the posterior aspect of the thigh, mostly occurring at the musculotendinous junction, although it can be at the areas where the tendon actually attaches to bone. This can be created by a slow or a fast injury. A slow injury is where a person is injured when they're overstretching the muscle. Fast injury is typically the classic one you hear where you feel a pop and all of a sudden then you're not able to fully run because of pain in the posterior aspect of the leg. The classic story that I think most people think about with a hamstring injury is an athlete who's running down the field trying to exert themselves at a high level and then all of a sudden feel a pop, or what they classically say is a snap in the back part of the leg. After this, they get pain and they have difficulty running fully because of the symptoms. This can sometimes create swelling or even bruising in the posterior aspect of the thigh. With a hamstring injury at first, it's going to be getting them off the field, evaluating, making sure where this injury occurred. Is this very proximal, or is this on a bony aspect, or is this in the mid-muscle region? And then ultimately getting some ice on them, calming down some of the swelling. We'll sometimes use anti-inflammatories in the short-term course to try to calm down some of the swelling and bruising that will occur. Ultimately, getting evaluated by a physician for this and starting into some sort of therapy is always going to be important. Prevention of a hamstring injury is going to be making sure you're in the best shape you possibly can, not overexerting yourself, making sure that when you are exercising, you're taking good breaks and making sure that the area is stretched out, mostly active stretching prior to practice and not the old static stretching that we always talk about of toe touches, which has not been shown to be as effective for hamstring injuries. Treatment for a hamstring injury is going to be a good history and physical in terms of what caused the injury and kind of describing it. We're going to do a good physical exam on that hamstring region as well as the knee and the hip, making sure there's no injuries in these areas, and then ultimately determining where this injury occurs, whether it's proximal in terms of up around where it inserts kind of right up in the upper part of the leg or down at the knee, or right in the mid-muscle belly, and then determining treatment based on where the injury is.